Welcome everybody to the first session of our Physician Scientist Career Development Panel. Today we're going to have a session on mentoring and aligning expectations between mentors and mentees. And our speaker is going to be Dr. Janice Gabrilove. I am, for those of you who don't know me, I'm Margaret Barron. I'm a professor and senior associate dean for basic and clinical research training. And I just wanted to say a couple of quick words about our virtual office for physician scientist research training. We've had a few initiatives, one of which is this career development series. We've also developed a database of prospective mentors for residents and fellows who are interested in doing research. And those research mentors, that could be basic translational or clinical research. It's not an exhaustive list. But we'll be updating it a couple of times a year and then sending it around to everybody. We also have initiated a GME resident and fellow publication of the month, where a panel selects a publication from among a number of nominated publications. And each month, one paper is highlighted in an email and then also on monitors throughout the medical center. And each author who receives this recognition also gets a $150 educational allowance to spend in however he or she finds appropriate. We've also provided access to clinical informatics for trainees who are interested in EPIC data queries. And then finally, we're working on a website which we hope will go live very soon. Today, in addition to Dr. Gabrilove, we have a panel of 5 individuals, an assistant professor, Katie Gutman. Katie, you want to raise your hand? And then Tisch Hughes, John Kanan, Carolina Maldonado Diaz, and Carlo Menina. So welcome again, everybody, and please join me in welcoming Dr. Gabrilove. So.
Okay, so what we're going to be discussing today is the importance of mentorship and particularly the concept of aligning expectations so that what you hope to get out of the mentoring relationship and what your mentor is hoping are in sync, if you will. So first and foremost, how do we define a mentor? What comes to mind? And I'm going to ask our esteemed panel if they can comment on what comes to mind when you think of the term a mentor.
Guidance.
Guidance.
Someone you look up to in a way.
Someone you look up to in a way, in a sense, a role model.
Example.
An example, serves as an example. Someone who serves as an example. Yes.
Maybe like a coach.
A coach. We'll talk a little bit, you're right, but there's a slight difference potentially between a coach and a mentor, but a mentor can serve as a coach, but a coach doesn't always serve as a full mentor, but we'll talk about that briefly. Any other concepts come to mind?
Knowledge, expertise.
Knowledge and expertise in the area of interest.
When accessible.
I don't want to leave you out down there.
No worries.
Okay, I'm sorry. You said.
Oh, sorry, someone accessible to you.
Someone who's accessible, has the time and opportunity. Great concepts in terms of how we think of a mentor. So this is taken from a summary of mentors' roles from the Council of Graduate Medical Education. Mentors are people with career experiences, willing to share knowledge, provide emotional and moral encouragement, give constructive feedback on performance, encourage opportunities, and serve as a role model, advisor, counselor, guide, supporter, tutor, and advocate. Very much along the lines of what you just said. We have a little bit of out of sync here because of the transference between a PC and a Mac. So qualities of a mentor. Think of a mentor, both those of you on the call and our panel here that you've had who's influenced your own practice, your research, and what were some of the essential characteristics that made them valued or perhaps not valued? So maybe from each of our panelists, give us one characteristic that comes to mind, not so much of what a mentor is, but of a characteristic of that individual or individuals that you think is an important attribute.
I would say transparency.
Transparency.
Could relate to my training.
Can relate to you, is relatable. Okay.
So confidence.
Confidence, but perhaps not too much confidence, as there was an esteemed, I forget his name now, but an esteemed Nobel laureate who spoke at the medical school graduation a number of years ago prior to COVID. And he had this talk about how the importance of a physician to have confidence, but not too much confidence. And the same is true in research, right? So good, confidence,
I think responsive and available.
responsive and available.
Expertise, thinking of research.
Expertise, yes, so complements a lot of what you talked about before. Any comments from the Zoom participants? Any hands raised, anything in the chat?
Nothing yet.
Please feel free, we are monitoring. If anybody has a comment or a question that's going to go in the chat, we're happy to entertain that. So this is just some shared comments from not only our panel, but from a prior group of graduate school and medical school faculty participants in our mentor training program. They mentioned clear communication of expectations, investment in each individual, not just favorites, approachable and accessible, access to state-of-the-art materials and resources, encouraging pushing for creative and critical thinking, providing opportunities to network, anticipate needs for planning the next career steps, empathetic, cares about your success, and leads by example as some attributes. These are some of the best characteristics of effective mentors from the literature summarized in this paper from the medical teacher in 2006, imparting confidence and trust. So our panelists are quite expert. Ability to create an environment conducive to achieving excellence. So creating a safe environment, psychological safety, one that values questioning and collegial exchange is a critical characteristic of effective mentors. Open to other ways of thinking and doing. Clarity of thinking and clarity of intent related to transparency that was already mentioned. An active listener, inspires the best in others, balance of support and challenge, knowledgeable of the mentee's capabilities and potential, so has an understanding of what we refer to as situational leadership, which is where a given person is at on a given task. Sometimes you need a lot of cuddling, and in other areas you need to be left to do your own thing, and kind of being able to modulate that based on the individual needs. And finally, not reading through all of these, maintaining high ethical and scientific standards. So there's some definitions of mentoring. Mentoring is really a developmental partnership through which one person shares knowledge, skills, and information and a perspective to foster the growth and independence of another. But I think what's important to remember here is it's a developmental partnership. The mentor and the mentee are both involved. And so it really means that, a mentor is not there to just provide everything on a silver platter. It takes two to tango. And although this definition emphasizes the knowledge and skill imparted to allow the mentee to move from mentor to independence, the mentor is also going to grow in their knowledge and understanding of mentee's perspective and how that will inform their own understanding of both science and other matters. Now, coaching is a method of directing, instructing, and training a person with the aim of achieving a specific goal. So mentoring certainly incorporates modalities of coaching, but it's a much larger umbrella in terms of really fostering, and in this, fostering an individual's growth and development in total. The other aspect of mentoring is this concept, especially in research, of moving from mentored to independent investigator. And that's a concept that, as you think about choosing mentors, depending on your stage of career development and of research capacity, to be confident that a mentor really has that experience and knowledge that that is really what the process is all about. Now, when we talk about mentoring, and this is important to keep in mind when choosing a mentor, there are really 6 competencies that have been described, and this is out of the Entering Mentoring curriculum that was established by Joe Handelsman, who's a renowned molecular biologist and Howard Hughes investigator and chaired professor at the University of Wisconsin. And she was troubled a number of years ago at the lack of evidence-based practice for training and mentoring graduate students in basic science. And this was then adapted by colleagues of hers to really apply to clinical science and clinical translational research career development. And the 6 competencies, which have now been further added to, and I'll mention that in a moment, really reside around maintaining effective communication, aligning expectations, which is probably of all, every other competency folds into achieving this concept of aligning expectation, assessing understanding, meaning where you're at a particular point in time as it relates to a specific task that's required for whatever it is you're doing. Addressing diversity and valuing diversity and optimizing inclusion, and promoting professional development. And the last one, which has recently evolved, is culturally aware mentoring. And so these really guide mentor training and also guide the mentee as you look for mentors in really what are your roles. Aligning expectations means that you need to have an understanding of what your own expectations are that really result from self-reflection, self-awareness. What are your needs? What are your educational goals? So that you can converse appropriately with a mentor, especially in the research realm, as we're discussing today. So this can be posted. I'm not going to go through this in detail, but just really is a chart that just relates these 6 mentoring competencies to a variety of skills. So fostering independence by really encouraging the ability to negotiate, to motivate, to build confidence, setting expectations and goals and strategies for achieving this, really appreciating a variety of backgrounds, and other skills that really go into this complex picture and provide a framework for understanding mentorship capacity. So what do mentors do? This is from a cartoon in the New Yorker magazine. They provide exposure and access. They share understanding of organizational values, relationships, and unwritten rules. They also identify needed skills and assist with setting appropriate milestones and goals. So these are some of the specific things that mentors do in addition to the broader categories that we've been reviewing. So another aspect of what mentors do comes from this cartoon. I'd like you to sign up for one of your courses on voice projection and pronunciation. And the other says, you'll have to speak up. I haven't a clue what you're saying. So mentors facilitate the development of realistic career plans, identify opportunities for growth and development, and try to open doors to enhance your capacity to take advantage of those opportunities. Act as a sounding board and practice affirmative listening. Provide and receive feedback, so the feedback doesn't just go in your direction, but goes in the direction of the mentor as well. Encourage reflection and self-awareness, in part by practicing that themselves. And finally, ask effective questions to create a process of learning, change, and accountability. So the role of a mentor is really to address educational needs that are identified. And you can often do this through the creation of what's called an individual career development plan, which is really a tool for you as a mentee, especially those of you who are starting or have begun the process of integrating research into your overall clinically oriented career. And that is by really doing a kind of a mini SWOT analysis to know what your strengths and weaknesses, areas of needed growth, that can serve as a template for conversations with your mentor to map your progress in the course of your research development. So in that context, for finding a mentor, it's important to first try to delineate what you want or hope to achieve. Be proactive about this. Speak with people you know and ask for referrals. Evaluate the coaching and communication style of the prospective mentor, their work ethic, the prior track record they have as a mentor and the progress of their prior trainees, and the work environment, culture, and tone that they've utilized. So I'm going to pause for a moment and ask our panelists what techniques or strategies they've used to actually find a mentor to foster their research career development.
In meeting with like program directors, associate program directors can be
So-
really helpful.
So meeting with the program director or associate program director to help guide possibilities.
Just gone based on my interests.
Delineating what your interests are, doing some searches, and then finding people that would meet with those areas of knowledge.
And also assessing how available they are as well, because some people might work on things that you're very interested in, but they might be too busy to foster a mentorship relationship. So it's also important to keep in mind that not everyone, even if they're experts on what you're trying to achieve, are suitable for a mentorship.
So assessing availability, and can I ask you, how do you go about that?
I guess you can ask for a meeting and kind of have like an initial encounter where you can express your plans or what you wish to get from this, and you kind of gauge how available they are based on, I guess, their response to.
Right, so I guess having a structured series of questions, so that really goes into delineate what you want or hope to achieve, and having some questions that really address this to be confident that this person will have the time to spend that you will need. Some Some people may not feel they very much need. Other people may feel they really need to, they would hope to meet on a weekly basis. Or they might ask, when you take on people in your lab or for a research project, how often do you meet with them and get an idea? And you can also talk to people who have been mentored by those individuals, who will also give you a sense of what the availability is. Because everybody wants to look good at the dance, but how they really function can sometimes be found out by talking to others. Other approaches.
I think after doing some research, another way, like I suppose already mentioned, is also try to have some reference somehow, meaning like you may know someone that has also a connection with the other person and know better, a little bit better the network which is around the person
Right.
to understand whether it's a safe dynamic, is a possible dynamic, or whether it may be better to just switch upfront to something else in order to avoid like losing expectation, because otherwise you invest so much in someone as a target and then you after like even weeks realize that it's not a fit.
Right. So that's a good point in that. So at least initially, kind of trying to investigate through a social network of people who might know this individual and how they function. A separate discussion is really if you get into a mentored relationship and it doesn't seem to be going well, how do you change course? And what are your options for doing that? That's almost a separate discussion, but perhaps you have some ideas, or I can posit some. Dr. Barron may have some sage advice.
So would you repeat the specific question?
So I think the issue that came up was, the strategies to find a mentor was, one strategy was to kind of look at their social network and talk to people who know this person. But in the comments arose the notion that, you could be working with this person for a while and it doesn't seem to be going well. How do you realign? Because this can happen even under the best of circumstances.
I would say approach the mentor and have an open discussion about what you think you need and what more you need, and whether or not that person feels that they can readjust the direction that things are going.
So I think it has to do with transparency and as much as you know what you're hoping to get out, having a very honest, respectful conversation. Most mentors, even if it's not working right, are going to try to help you navigate to a different approach.
I think maybe also having like a team of mentors where if that, not everybody can be everything, right? But if there are features that you really are benefiting from, but there are other things that could be filled in that could be supported by another member of your team, then that could also be a good.
So I think that's an excellent point. We're just going to talk about that in a moment, but this notion of matrixed mentorship, that not every mentor is going to be able to provide all answers to all of your different goals. And sometimes there's a tendency to think that one mentor is going to provide all of this, and that may not be optimal. And also in research, it's advisable to have some co-mentorship. There may be somebody who is your PI, but often there is an added mentor who brings a different skill set, another direction. There are a number of training opportunities that you'll learn about or have learned about along the way that are more and more requiring on a T32 training grant, for example, or even on mentored awards. There's a requirement in the career development section to really articulate a need for added mentors that bring additional expertise, because no longer, given the wealth of data that we have, can one person really embody all of the skills that you might need to develop in a particular research, to answer particular research questions. So excellent point.
I was just going to add that one person might be ideal for working with more directly. Another person might be less ideal for that, but better like on the side. And figuring out that too, it's sort of like the next step. Yeah.
I have often, as a senior faculty member, I'm often approached as a sounding board. And I take that mentoring responsibility very seriously as a sounding board to help people navigate their path, even though I'm not really their direct mentor in their research. I can help them talk out loud, if you will, of what are their choices, what are the alternatives. And so having someone like that in your camp is very, very useful to help clarify your thinking. Something that you think might be a problem may not be a problem if you view it in a different context or realize there are some solutions that you hadn't even thought of. So having people like that in your camp is very useful.
I was just say, maybe we can come back to this more later, but the key thing for me right now is whether the mentor has had a physician scientist mentee trainee before, as opposed to a PhD student, a PhD postdoc, right? So maybe we can come back to that.
Yeah, I think that's an important point, and maybe should be added to this list. Experience with the unique category of a physician scientist or a surgical scientist, because of the understanding of the time required for to maintain clinical proficiency, especially in surgery, where you have to maintain the ability to operate, let alone in a clinical realm. Even if you're saying you're going to spend 25% of your time, it turns out to be really 50% of your 200% time, because that one patient wasn't, cooperating, and you couldn't just see them in the 20-minute visit. So, yeah, somebody who understands and appreciates and values that part of you has to be more holistic in their approach for, excellence in science, whether it be a physician or a PhD candidate. So excellent point, to really look at when you're finding a mentor, somebody who appreciates that particular category. So we talk a lot about mentors, but we should also think about mentees. And mentees are someone who has identified a specific personal or professional goals and believes the guidance and help of a mentor can help to achieve those goals. So during the job interview, your lawyer? No, my mentor. So this is some guides for mentee key points. Ask for advice. Avoid the good daughter, good son, good person syndrome. And what I mean by that, which I suffered from, is you want to show how self-sufficient you are, how you won't be a drag on anyone. You can do most things yourself, so you won't be a burden. But in fact, most mentors want to feel valued just like you. And so they actually want you to ask advice. And when you don't ask advice, this can actually be misinterpreted as if you think you know it all, when in fact, that's the farthest thing from your mind. So I always think, ask for advice. Even when you think you know all the answers, you may actually learn something that you didn't appreciate. So ask for advice, ask for advice. Be an active participant, a recurrent theme here in the relationship. It is a partnership. Take ownership of this opportunity. Welcome and invite constructive criticism. Practice talking to yourself in the mirror that, you can let some things go in the ear and out the other, not to take it personally. Constructive criticism is your best friend. Obviously can't be destructive, but constructive criticism will help you get better. We've all experienced this, but it's really important to really get used to that. Be considerate of your mentor's time. So you want somebody who has time and availability, but you also want them you want to show that you've done some thinking proactively of what you want to gain from your regular meeting with them. And so in that sense, you're being respectful of their time. And as a result, they're usually going to want to spend more time because they know that you're always prepared. Listen to what your mentor has to say. That doesn't mean you have to do what your mentor says, but at least listen and process it, and not perseverate just in what it is you want to do. If it's really very different than what the mentor, then you have to really work at coming to a meeting of the minds, especially when it comes to, a research approach. Not addressing that and kind of going off and just appearing to ignore is not going to be helpful. Follow through on your commitments, just like you want the mentor to follow through, really be respectful of milestones that the two of you or the group maps out to achieve as part of your professional development. And as physician scientists, we all know that. We can't tell patients one thing and then never follow through on it, but the same is true in your research career. And show appreciation. You want to be appreciated. You want to be valued. This is something took me a while to realize that, mentors want to feel appreciated. That's why they're doing it. That doesn't mean they need their ego stroked every 5 minutes, but there are ways to value individuals. And then you also need to create time. So just as the mentor may create time, our schedules are very busy. We constantly have pages. We have to run to this or run to that as physicians. We have to set aside some time that's truly protected. And let some of your mentors, your primary mentor or other mentors, I gave myself as an example, go to bat for you. Your division chief isn't making the time for you to protect. Your residency director is not really allowing for that research time that was promised. Let other faculty help make the case for you, and put their foot down, and utilize effective arguments to allow for that time to be maintained. I've certainly done this a lot. I'm sure Margaret has done this a lot. Let more seasoned faculty be your advocate. So it's just kind of re-echoes what mentors look for in their relationship, providing help, appreciation, their own growth and development, the interaction, and the enjoyment. So some of the keys to a successful mentor-mentee relationship. Before I provide this, we'll ask our panel members. What do you think are some of the keys to having a healthy mentor-mentee relationship?
Awesome.
Sure, sir. One of the main things that I always think about is that a good mentor knows you. Like they've taken the time to hear you out and understand where you're coming from and where do you see yourself. And they're not just giving advice from far away and letting you decide if you want it or not. Like a good mentor is there with you and they really know you.
Okay, good.
Knowing what makes the most sense given the time you have to get to where you want to be.
Okay. So, yes, but from both perspectives. So the mentor and the yes, exactly. Yeah. Okay, given the time frame that's really operative for that particular stage of your development.
Yeah, I would say number one, set your role, and number two, set your goal.
Number one is
Set your role.
set your role and set your goal.
Yes,
Yes.
very clear.
And by role, what?
What you can offer and what you can receive.
Okay, good.
I think a certain degree of honesty with each other and vulnerability, sort of like what you were talking about, like coming to a meeting with questions and like, I'm struggling with this, can you help me? That kind of thing. Yeah, I think it's just like clear communication and action items, including when your next meeting is, sort of what you both expect when you meet again,
Right.
can help with practice.
Good. So let's see. Partnering, communication, inviting assistance, defining your needs, roles, and goals. Consider additional outside complementary mentor advisor perspective and mutual trust and respect. So this is the notion of this matrix mentoring model where the centerpiece is really you and really emphasizes your own self-awareness, your own self-management, your own self-assessment in terms of what your needs are. You want to do, get involved in systems biology and computational approaches, and you haven't done math in a while. So maybe you have a big need that you have to know about and decide whether that's realistic to pursue that type of approach, or whether there are other skill sets that you have that could be further enriched that would make more sense. So that's why self is right in the middle, because that is going to help the partnership. You're going to have your clinical and scientific mentors. As physician scientists and surgical scientists, you'll have mentors in both realms, and sometimes there'll be one that's overlapping. But there are also other mentors, near peer mentorship, which this is a good example of for those on the call. Staff. I would really make a point of finding somebody, for example, in the GCO, the Grants and Contract Office, or the IRB, if you're really envision your career as being a clinical trialist, or someone in the research group in your lab, the lead research assistant or technician, to really ask them, see them as a mentor for, lab techniques, or for IRB submissions, or for NIH best practices. They have a wealth of knowledge, rather than viewing individuals as somebody who can get something for you, but rather view them as a mentor to really foster your development. Maybe you know a lot about NIH approaches, but maybe you know very little bit. Which institute is the best one for you? Your mentor is going to help you with some of this, but really asking professional staff who are doing a lot of these things on a regular basis and have a wealth of knowledge to consider as a mentor, as part of your mentoring team. And this is this notion of the matrix mentoring model that incorporates other people. And then this notion of a senior person, I gave myself an example twice, would be an example of somebody who's outside your sphere of clinical expertise and or research, but who is a senior member who can serve in this capacity because understands the landscape, understands that if you want to go from point A to point B, what are the threats, what are the challenges, what are the exciting ventures, and some tips on how to navigate that.
If I could make a point. One of the best ways to expand your group of mentors is by meeting other scientists or clinicians at conferences and getting to know them. And if you go to the same conferences again and again, you're going to run into the same people, and some of those people will become your mentors, and that's really valuable.
And that's an excellent point. Excellent point. And when we talked about looking for a mentor, that is really one of their roles, the mentors that you have, is to really open doors. So I'll give you an example for myself. I was recruited back to Sinai over 20 years ago by the chairman of medicine at that time was Dr. Barry Kohler, who still comes back to Sinai in a teaching capacity, but is the physician in chief at the Rockefeller University. And he recruited me to be the chief of oncology. And one of the first things he did when I arrived, I'm a hematologist oncologist and a blood cell specialist. And one of the first things he was the president of the American Society of Hematology at the time, is he invited me to be on the review committee for that year's national meeting to review all the abstracts, but in an area of my own expertise to be part of that. And so I went to the review meeting, and as Margaret commented upon, at that review meeting were many key individuals who would be very good for me to get to know, to advance my own career opportunities. And they were able to see me in action, and I was able to form some networking opportunities. And that's because Dr. Kohler opened the door. It was up to me to take advantage of that. He didn't take me by the hand and say, this is Dr. So-and-so, it's Dr. So-and-so, but it was the opportunity, it was the opening the door. And so mentors should do this for you, but you have to then recognize what they're doing and read between the lines and try to leverage and take advantage of those opportunities. Is just building upon what you had said. And some of those people did become really important mentors for me.
And sometimes friends.
Yeah, and friends also. And in fact, one of those people is still on our external advisory board for our cancer center. And I still have learned so much from, and not just in my science, but also in terms of how he actually conducted his affairs. So he was really a role model. He's a very good listener. And I was not always such a good listener. I've become much better. I'm still working on it, still a work in progress. So some of the things to try to avoid, dropping the ball, not following through on your commitments. Sometimes you can't follow through on your commitments. Life happens. Things happen. But communicating that and say, I'm not going to be able to get this done by this time because I've been sick. My mother's not been well. So-and-so had an accident. I have an increased call schedule because one of the residents left the program. Communicating that as to why you can't, there's a recognition that there was a deadline that you're not going to be able to meet is going to be, appreciated, and there'll be a solution. Not communicating that is in a sense like dropping the ball. That is going to work against you. Lack of this effective structured work relationship, knowing what you want to get out of things, knowing roles and responsibilities, knowing your role, what you want to receive, and coming to the table prepared for that conversation, using an individual career development plan format, simple as it might be, can really help facilitate that. Having unrealistic expectations. I should have a Nature paper in 6 months. Or I had this idea, and then 2 years later, somebody else is doing all the research to do that, and you think that this is unrealistic expectations.
We have a question
Yeah.
from the chat. In the matrix mentoring model, do the panelists have any advice or personal anecdotes regarding how to tactfully navigate differing perspectives between primary mentors and their other mentors?
So I think the question here is that your primary mentor may suggest you do X, and you go and you talk to somebody else and they suggest why. How do you align the two? Do you have any anecdotes or advice?
Well, I don't know if this is the exact scenario that might be in mind, but so in our psychiatry research track, this first half of the year, I have 2 months total full-time research, and I can schedule them whenever. So there are these two mentors, and I asked one when I should schedule them, and she said something, and then I asked the other, I told the other one I had scheduled it in this way, and she asked me to change it. So the lesson was just like talk to both to like make sure we're all on the same page. I had to change it. But the first mentor really shouldn't have said that without like covering all bases. Yeah.
So you already knew that this was going to be a co-mentored.
Yeah.
Yeah.
They have a grant, they have an R21 together.
Yeah.
And I'm working with them both.
Right.
Yeah.
It's like honest communication.
Yeah.
And being clear about it, yeah.
So I think in that situation, you had two scientific mentors.
Yeah.
Right? And they had a slightly different approach, and it would be best not to say you really should be communicating with the whole group. What might be different is a scientific mentor says you shouldn't go to that meeting because you're not presenting at the meeting, and it's not it's not going to be a good opportunity for you. And you have somebody who's a sounding board who says, well, you should go to that meeting because you will meet other people who are in the field. And even though you're not presenting this year, you've only been working for 2 months. There's no reason why you would have an abstract or time to present any work. But if you have the dollars, I would go. And so I think in that context, again, it's open communication.
Yeah.
I would go back to the mentor and say, I was also talking to so-and-so. I would start off with, I really respect your advice and I know I have to work on my project. But I was speaking to one of the other faculty who I've, been close to, and they were suggesting that maybe there would be some opportunity to meet other people in the field who would really give me some insights into the research that I am doing with you. So what do you think? And approach it that way, but be very transparent and honest about it. Is probably the way to go. I hope that answers that person's question, but if there are others, I'm sure that we'd be happy to reach out to Dr. Barron for her advice, or me. If you think that would be helpful. Other things in the chat?
That's the only one that has so
Okay.
far.
I will add this advice also. I don't know whether we'll answer this question, but whenever
Can
possible.
you speak up a little
Yes,
bit
yeah.
because there's a
Okay.
loud.
I see them.
Yeah.
Yeah.
Okay. Whenever possible to avoid duplicate, like the mentors. I mean by that, like if you can rely on one main mentor and other as a like more senior or someone like as a counselors, but having like a guide. Otherwise, if you hear too many voices, you're kind of stuck in between and you don't move either right or left. So try to, whenever possible, because sometimes you cannot, like the example, like for instance, that you just did show. But in general, it's like if you're naive, so you're free to choose, try to just identify one person. And anytime there is another source of information that may be conflicting with the other, don't take equal response on the answer. So really try to follow who do you believe it would be your long-term guide.
Right. So I think that's correct. I think, in terms of co-mentorship, I'm sure that for example, the example you gave, that the two mentors have complementary scientific contributions. And so I think in that sense, because it was a shared grant, it probably, you learn something from that, it probably was a good idea to kind of get the group together to begin with. And one strategy for any team science approach is to get everybody in the room together and decide upon the rules of engagement. And even with three, two more senior people than yourself, really organizing a meeting and say, we're going to be investigating this. I'm going to, what my role is going to be X, and we should really decide how are we going to work? Should we meet as a group once a week? If I'm going to be focusing mostly on, project X or problem or question Y, and that's really in mentor A's domain, should I meet weekly with this person and monthly with the group? Having some organizational meeting to really, with everybody at the table, is very useful. When you have a larger research team, it's good to get everyone to decide upon the rules of engagement so that everybody takes ownership in a collective, with some collective wisdom. I do think you're right that, you'll have a primary mentor who's going to guide you. But I think if you're in a situation where you have a co-mentor, it usually is, the co-mentor should not have the same skill set. That is correct. But for example, in the clinical research program, we often advise somebody who wants to do a given project, we may feel that the primary mentor they've chosen is really, especially as physician scientists, is exquisitely knowledgeable about the clinical phenotype, but lacks methodological capacity as it relates to analytical skills in biostatistics, for example. And you should not be the person who's left to be the biostatistician, working with a biostatistician that's just in the larger team who may or may not have time for you. We will often suggest that a co-mentor be a biostatistician who really agrees to be a co-mentor and takes on that full capacity. And in that context, that co-mentor has a very different skill set than the primary mentor. And decisions about the research should really be done as a group. If you're working on a project that interfaces the two. So that's an example where co-mentorship should always involve complementary skills. You shouldn't have two cellular immunologists who have a slightly different approach to understanding cellular immunology being co-mentors, because you're right, it's going to be difficult to know who's really in charge. I think that's what you were relating to. So just in summary, it's never too early to get started. If you're thinking about incorporating research in your career, or you've done research, you had to take a pause because you're very clinically invested in your early part of your residency, but want to come back in, it's never too early to get started. Meet with Margaret. There are senior faculty in your departments and divisions, I'm sure, that would be more than happy to respond to even a cold email, or perhaps they know you already, would be happy, I'm sure, to provide time. Remember that this partnership is really a learned response. It's an iterative process of continual professional development. The capacity for that partnership is going to be enhanced by your engagement, your self-reflection, your self-awareness. Communication will be facilitated by using an IDP of some sort. And it's enriched by participation in programs like this, in a mentee and mentoring community of practice to advance these principles. And so with that, I'm going to stop and I will leave time for questions or comments or other comments from our panel
Or from.
or anybody here. One thing I would add is that for those who have not pursued research before, but have been struck by so many questions that you might have that are directly related to clinical observations, as clinical scientists and as clinicians, we have a wealth of observations that we shouldn't take for granted. And just because you don't have a background, it doesn't mean you cannot do research. You need to make the time for it, but it's never too late to get started. And it's never too early to start investigating possibilities. And even if you don't have a perfectly formulated question, don't suffer from imposter syndrome. You know, I'm not good enough. I haven't thought enough. I don't have this. You know, just, it's like writing a paper, right? It's somehow times difficult to get it down and you try to write the perfect sentence the first time, just make some bullets. Same with research. Just make some bullets, what you're interested in, and find some of the people who have some knowledge in that area. And ask them for advice. How do I get started? I will also say that we have an emerging investigator website on Sinai that has a lot of information about how to get started in research, best practices in mentoring, and a variety of other information and resources. We can provide the link to Margaret, or you can just Google rather, early investigator or emerging investigator website at Sinai and it will pop up. That is also a tool or a resource.
Can I ask a question? It's a hypothetical scenario.
Hey, how are you? Yes.
Let's suppose that you have like a mentor, let's say in immunology, but you want to explore like integrating, for example, genomics in your approach. How would you advise like someone to try to build like collaboration with another PI as a second mentor? Like what would be the optimal like first approach?
So I guess from my perspective, the first thing is I would talk with my primary mentor and tell them some of the questions you're interested in that would take the research in a new direction, and get their feedback. And that, you know, that again, that may be part of your mentor to independence, even if your independence is, you know, several years away. Not completely that far away, but, you know, far enough. If they buy into it, which I'm sure they will say, well, that's really cool. Then ask them, you know, who do you think in genomics here would be the right person to approach? Or you could say, you know, I've checked out the Department of Genetics and Genomic Sciences, and I think that person A, B, and C might be the right people, but I'm not sure. What do you think?
No, that's great, thank you. Part of the difficulty for that would be that there's no like, there might be no funding like for this like new endeavor from either lab. So would that be like an opportunity to apply for funding, or like what would be like another approach if you don't have your own funding?
Yeah, so I think there's always new approaches that people are taking. You're right, they can't, you know, if they have funding to do certain work, they can't completely divert it. But if it's an extension of an ongoing project, then some of those funds could be with a limited to generate some preliminary data. Could be justified. If it's a completely separate project, has no relevance to anything you're currently doing, that's a little more problematic. Then you might have to look for internal pilot funding awards. And you could ask your mentor about that, if it was completely, but very often it's you're working on one specific aim of a larger grant. And now you want to take that because of the research you've been doing, it might go in a new direction. Most PIs are going to see that may work, there are some experiments to do that may not turn out, but are still something that could be incorporated into a progress report. So what do you think?
I think I give the same answer. you did.
Okay.
Yeah.
Good.
And the only, if the mentor has funding and the research is not going to take you too far afield, then you might be covered. And otherwise you have to look for other sources.
Thank you.
Maybe a possible way in between, like off the line whenever possible, maybe possibly start to knowing each other by doing something like a project that will not require funding, for instance, rather than going for original super important publication, try to find like a topic, like a review, for instance, or something like that, where there is an overlapping of the two domain, in which the two PI can have an integrated approach, so they know each other. And if the project goes well without any request for funding, because like, for instance, just the first things that comes to my mind, the review, for instance, then there is enough trust to say, okay, we might have something here for doing something future together in a proper way. So in another way, putting things super easy, this way they know each other and they know what they may offer on the two sides.
Yes, you're right, but it still would need to relate to work that they're doing somehow.
Yes, there should be an overlap.
Yes. But there's also the other, as we mentioned, is that there are pilot initiatives for high risk, high reward kind of both internally, and then there are of course grants that you can go after. And so some of it, you can try to find out about internal pilots that might allow you to do this, that you could look into. Yeah.
So far, nothing in the chat. But please feel free to unmute yourself if you have a question or comment.
So Tara, it looks like I see a number 4 next to the chat. Have we covered everything?
Those are my messages.
Okay. Okay, well, thank you very much, Dr. Gabrilove, and thanks to our panel. And I'm sure you've taken something useful out of this discussion.
Thank you.
Thank you.
Thank you very much.
Thanks.
Thank you.